Hi, everyone. Welcome back to another episode of Living with Hep B. I'm Executive Director Richard So for Hep B Free. I did want to send you all some exciting updates. We recently this year changed our name to be just Hep B Free instead of SF Hep B Free Bay Area. And we have, as you can see on my page, a new logo officially. And that is in order to reflect a new expanded mission in which we are trying to help other local coalitions across the United States strengthen or create new hepatitis B advocacy programs. And so, if you are interested, please contact us. I will have all that contact information at the end of the video as well as in the description. And so, we're looking for new partners who want to do hepatitis B work in their own locales, and we even have set aside some budget to aim towards that goal. So please shoot us an email and we can see what we can do. Today, I'm super excited. With us today is my friend named Emma. She actually came to one of our events locally in the community and started talking to me and was so kind and brave to jump on this program and tell her story about her relationship with hepatitis B. And so, with that, welcome, Emma, to the program. And I guess we can start by why don't you tell us a little bit about yourself?
Yeah, so my name is Emma. I live in San Francisco, California. I moved here 7 years ago for work. I am a software engineer and I work at a digital health company called Included Health. And they're actually really big into healthcare advocacy and increasing access to care for patients. And I feel like that's a big thing that we also need for hepatitis B. I think I'm very fortunate to work there and work with other people who are similarly, mission driven about wanting to improve healthcare. I just think that healthcare is something that we don't necessarily want to have to deal with, but everybody has experienced the healthcare system in one way or another.
Mhm.
And so I feel really grateful to be working on a product that helps improve lives for like real people.
That's really cool, and I'm glad you get to work on something that you care about and that can be related to Hep B. Me and Emma have talked a bunch when we were at this our annual run fundraiser where she burned me, by the way, so fast. So that was fun. And yeah, like I'm happy. We should definitely talk more about how we can get like you involved, or maybe there's some sort of thing that your company provides that we can really tie the two things together. Yeah, so I guess the next question is, could you please tell us a little bit about how you and Hep B and your lives collided?
Yeah, so I was born in China and adopted when I was 9 months old. I grew up in Toronto, Canada. My family, they still live there. Um, and then, like, when I was 12, my doctor ran a blood test for hepatitis B and also hepatitis C. I'm not exactly sure what prompted her to do it because at
Mm,
the time I didn't have any symptoms. Um,
huh,
I mean, possibly she heard from somewhere that like China is an endemic region for
right.
hepatitis B, and therefore, like people who are born there should be tested. Again, I'm not quite sure why I was tested, but it came back positive. Um,
Mm,
my parents didn't know about me having Hep B when they adopted me either, so it was
mm.
news to all of us.
Interesting. So, I mean, there's so many things that we work with. If folks have listened to us already, you'll know that they made here in the United States hepatitis B testing of pregnant mothers in the early 90s standard protocol. But for folks who, like Emma, who got adopted, we don't really know what the standard is. And we know now that and a lot of, unfortunately, since it's not a normally tested for disease and annual physical, that it's really up to many individual doctors to go, oh, like Emma said, like maybe this person is from a at-risk country or at-risk behaviors. And so just to recap there, the current standard from the governing kind of rules group called U.S. Preventative Services Task Force is that folks who should be tested include folks who are born in countries where the rate of hepatitis B is high, which includes most of Asia, folks who are born to parents from those high endemic regions, and then a series of behavioral risks that are unfortunately associated with mostly negative things, including multiple sex partners, men who have sex with men, folks who are IV drug users, or if your profession involves exposure to blood, like surgeons or people who work in long-term like hemodialysis centers, things like that. But we know that a lot of physicians who are testing folks uh, are having to remember that and often may not do that. And so we hear lots of stories where folks say, oh, I'm born from Asia, but my doctor never tested me. And I don't really necessarily blame physicians because they learn about it for just a little bit and they have to remember all the things they have to remember when they're seeing patients. And so when you say you're not sure when you're like a young person why they tested you, because Emma, you hadn't been tested to your knowledge before that when you were a little bit younger, right?
The interesting thing is my parents, like, supposedly I was tested before
Mm,
I came to Canada as a baby.
okay. Yeah.
Um, and that was negative. So I'm not
Interesting.
exactly sure what happened. Like, I'm not sure what age I was when I was tested because I do
Hmm.
know that there's a bit of an incubation period window, like
Right.
after you first get exposed to the virus
Right.
before it will show up on a test. So
Right.
obviously I was a newborn at the time, so I
Hmm.
don't know exactly what the timing was of
Hmm.
any testing that they would have done.
Yeah. Yeah, that is interesting and kind of mysterious. Um, okay, yeah. So in any case, so then you at 12 years old you find out that you have Hep B, and then how did your parents react? How did you react?
Yeah, so my parents, they were like super scared and super alarmed when they got the call from my doctor, and they actually called like this like Toronto Public Health hotline to get
Hmm.
more information and advice because no one in the family knew anything about hepatitis B.
Hmm. Hmm.
And so then after they'd gotten a little bit more information, that's when they like sat me down and told me about it. They didn't try to like keep that information from me. And, like as part of my advocacy work around hepatitis B, like I've seen other patient stories um, through, Hep B Free and also like Hepatitis B Foundation. They make a lot of videos and
Hmm.
um, one of the things that really surprised me is there were a lot of people who, found out that they have hepatitis B when they're like a young adult. And then
Hmm.
they go and they like talk to their parents about it. And their mother is like, oh yeah, I have this, and like all of your uncles have it.
Hmm.
And I'm just like, what? Like, how do you not even tell your own family
Right.
about this when you know? It's a little bit mind blowing to me, but I'm glad that my parents didn't try to like keep it from me.
Yeah. Yeah. Do you think so being 12 is still pretty young to be told you have a disease that you will carry for the rest of your life. Like, were you really scared? Did you like do a lot of the research then, or kind of just go, okay, my parents know best, and then start learning more about it when you became like a later teenager?
Yeah, that's a really good question. So, when I was first diagnosed, I don't know that I knew like what to think, but I got referred to Sick Kids Hospital in Toronto, and
Hmm.
I started seeing a gastroenterologist there. And
Hmm.
like they gave me some good information about like how it's transmitted and like how to prevent spreading it to other people. Um,
Hmm.
I don't think they did a great job of explaining some of the like longer term health consequences of hepatitis B. So I don't actually think I worried about that,
Hmm.
even when I
Hmm.
maybe should have.
Yeah, yeah, that's interesting. I think well, so historically, and I think Emma, you've learned about this too, there used to be this idea that, oh, you can be a healthy carrier and have the hepatitis B not do a lot for a long time. But then in the last 10 years or so, we've professionally moved away from that because people often would then say, oh, I don't need to go in for my checkup appointments because folks who have chronic hepatitis B are supposed to go in every 6 months. And people would say, "Oh, I've gone in every 6 months for like 5 years, and they always tell me that I'm okay. So do I still need to do this?" And some people are fine after they don't seek more care, but other people, will stop getting that checkup and then end up developing liver disease or liver cancer 5 years down the road, 10 years down the road. And so we used to hear stories of people saying like, oh, my doctor said it would be fine and I would be fine.
Mhm.
And then, but nobody wants to take that roll of the dice chance.
Right.
Um, yeah. And
Yeah, and
so,
basically that's what they told me. Um,
mm,
they said that I'm like a healthy carrier, and normally when I think about a carrier, it's like I think about some sort of genetic like recessive trait where a
mhm,
carrier doesn't have any symptoms of the
right.
disease, and obviously like that's not the case at all for hepatitis
Mhm,
B. So I think that term of like carrier is highly problematic for that reason.
mhm,
Um,
yeah.
yeah, and I guess like for me, when I was a kid, I kind of resented having to go to like the hospital for checkups and spend an
Mhm,
ungodly amount of time in the waiting room because I
mhm.
would rather just like be at school, like with
Yeah,
friends,
be a kid.
doing extracurriculars, whatever.
Yeah, yeah.
I mean,
Did,
I guess like the good thing is I still like did it. I still
yeah,
like went to the doctor even though I didn't like it.
yeah. Did so in terms of management when you were young, did the your doctor say, okay, we're gonna have to see you every 6 months and maybe do an ultrasound every year? What was their like care or management plan for you?
Yeah. So I was being seen every year with I think it was like blood work every 6 months and an
Mhm.
ultrasound like once a year.
Yeah, yeah. Okay, yeah, that's good. That's pretty much what we recommend, unless sometimes people say ultrasound every 6 months, but pretty much ultrasound every year is good. Okay, and then for I'm curious, did you experience any stigma from others where your parents like, don't tell other people you have this? Did you feel like, oh no, I have this scary disease, and did that affect you kind of psychologically?
Yeah, so like when my parents told me that I have hepatitis B, they were like, don't tell anyone
Mhm.
because they were worried about the stigma and they thought like people would judge me
Mhm.
negatively or like exclude me from things.
Yeah.
Because I do think there's unfortunately still a lot of misinformation about hepatitis B. Um, and I want people to know that it's spread from blood to blood contact. So you can't get it from, casual social contact, sharing food,
Hmm.
shaking hands, anything like that. Um,
Yeah.
but I do think there's still like some amount of misinformation.
You're absolutely right, and it's great. You couldn't say it better. I couldn't say it better myself. I think all the time. In fact, in a education 2 weeks ago, I was talking to a woman who said, "Oh yeah, I've heard about this. This is important. We gotta make sure to tell people. So you got to be careful about sharing food with other people or sharing drinks. And I was like, actually, ma'am, that is not how the disease is spread. It is just through blood and sex. And so we really want to stress that just being around a person or a family member who has this isn't meaning gonna that you're going to catch it through the air or through saliva. That's just not the case. And as you know, in many Asian families, the family unit is so important. So when people get isolated from that family unit, that just leads to more stigma and
Right.
difficulty in people's lives. Um,
Yeah.
yeah. Did you was there a stage in which you decided to start talking about it at all?
I feel like that was only very recently.
Mm,
I'll get to that in
okay.
a few minutes, but I think one of the other things that I want to stress to people is like when I was diagnosed, like my family, they did go and get tested because
Mm,
like they recommend that household contacts get
right.
tested. And, you know, when my parents were kids, the hepatitis B vaccine hadn't been invented yet.
Hmm.
And I guess like in Canada, they weren't really like recommending universal adult vaccination. So like my
Right.
parents had never had the vaccine.
Oh,
Um,
wow.
and yeah, so like everyone went and got tested and they were all negative
Okay.
despite having like lived in the same house and them
Yeah.
taking care of me for 12 years.
Yeah, your whole
um,
life.
yeah, like
Yeah.
they never got it from me.
Mm-hmm.
Obviously they went and got the vaccine
Mm-hmm.
when the test came back negative. So I think that that does make me feel better that it's
Mm-hmm.
not
Mm-hmm.
super duper transmissible. And my viral load was in like the tens of millions at the time, like very
Mm.
high.
Yeah, wow. For those of you joining us new, hepatitis B is super infection, unfortunately. It's, I think, 10 times more infectious than HIV. And so that is why the vaccine is so important. And I think that is why people get scared. They think about, oh no, like this is such a infectious disease. But again, if you get the vaccine, it protects you for life. And then you can have as much exposure as possible and you're safe. And so that's why it's critical that if you live with someone or you think you might be exposed, you can just get that vaccine. It's covered in the United States here. It's covered under almost all insurances, including Medicare and Medi-Cal. Or Medicaid, and you can then be protected. And whether you find a new sexual partner through a relationship who has it and who may not know, then you're protected. Or if you work in a hospital or some other situation, you would be protected. So that's one of the great things about fighting hepatitis B. Which brings me to another thing. We haven't had a Canadian do a story with us. The, were there any differences, especially now that you live in the United States, about the Canadian healthcare system and now here in the United States?
Yeah, that's a good question. I think the biggest difference is that in the US, people have a lot more choice of which healthcare provider they want to see. So,
Hmm.
in Canada, if you want to see a specialist, you need to get a referral from your family doctor. And
Hmm.
it's also hard to get a second opinion if you're not
Hmm.
happy with the care you're receiving. Um, I guess an example of that from my story, I wasn't super happy with the care that I was getting at Sick Kids, and they had told me that, you know, like when I turn 18 and age out of the pediatric system, they're gonna send me to like this other hospital. Um,
Hmm.
and you know, when I got to be maybe like 16 or 17, I said to them like, you know what? I think it'll be better for me if you just send me there now. And they were
Hmm.
like, we can't do that.
Hmm.
Um, but like I guess the other thing is, and this might just be a sign of the times. I'm aging myself a little bit here, but
Hmm.
when I was in Canada, I didn't really have access to my medical records. Um,
Hmm.
And I guess that's more because they didn't have EHRs, you know.
Yeah,
Um,
yeah.
but then my very last year living in Canada, before I moved here, the hospital finally did implement an EHR, so I got like some access to my medical records. But like during the time that I've lived in the United States, I've always had that. And I think
Mm,
like having my records available where I can see them has really like immensely helped me to become
mm.
more informed and understand what my lab test results mean. And then I'm more proactive about managing my health, like as a result.
Gotcha, gotcha. Interesting. Like, because then you can like kind of see immediately what you have and what you are doing. Okay, okay. So I guess if we fast forward a little bit to your current life, um, how has hepatitis B affected your current life, if at all? Or is it something that, fades to the back of your mind? Do you feel like you're reminded of it in your average day, like in terms of your management and care? How does that affect your life?
Yeah, I would say that it does still affect my life. Maybe we will rewind a little bit. So
Mm,
around the time that I turned 18, like the virus started becoming more active for me.
mm,
Like I said, up until then, I had no symptoms whatsoever.
okay,
And I guess I was lucky in that that was around the time that I got my care transferred out of the pediatric system in Canada. And so
gotcha.
I started seeing like really top-notch specialists at University Health Network, which is
Mm,
it's a group of research hospitals that are affiliated with the University of Toronto. So it includes places like Toronto Western, Toronto General. And so I
mhm,
started seeing a really top-notch doctor there. And they got me on treatment with tenofovir like right
mm,
away. Um,
mhm,
and I'm very grateful for that. I mean, it was a scary time when
mm,
my liver enzymes were like through the roof, but
yeah.
I really think that getting on medication probably saved my life.
Interesting. Did you feel like were you actually starting to feel symptoms?
Yeah, like for the most part, I was just like tired all the time
Hmm.
and
Hmm.
sometimes had like no appetite.
Mm,
And so
mm,
those are things that I didn't really associate with hepatitis B or like liver inflammation because they're
yeah.
kind of non-specific symptoms.
Right, right.
Um,
It's like, oh, I've
and
been working
so
hard or I just haven't gotten enough sleep, right? Yeah.
yeah, yeah. And I
Hmm.
think that's one of the things that I like wish um, could have been different in my care journey.
Hmm.
Like if the children's hospital had told me like it's possible that the virus might start being more active and
Got it.
it could be like a year that that happens. It it might not happen for decades, but like
Yeah.
regardless, these are the symptoms you should be looking for. And
Yeah.
then if you notice any of these things, like give us a call.
Yeah. Hmm. Hmm. Yeah, that makes
And
a
I
lot of
mean,
sense.
I think
Mhm.
if they told me that, I probably would have, like gone to the doctor sooner and
Yeah.
gotten on treatment sooner. Not that, not that I was like that for multiple years,
Yeah. Yeah.
but still.
Yeah. I mean, that's a great perspective. For those of you listening, most people up to 90% have no symptoms at all. And in Emma's case is actually quite common. When we rattle off that statistic, we find that a lot of times maybe in that realm of no symptoms actually falls a lot of people who feel like a little bit tired or even a lot tired or some discomfort or lack of appetite, what's described as fatigue. And but a lot of times people don't know because whether maybe they work long hours or maybe they just have stress in their lives. So it's hard to tell exactly as Emma said, whether it's from hepatitis B or not. So we definitely tell patients to say, make sure that you go in and describe things, even if it does feel like regular aches and pains around hepatitis B. And that and what we try to tell physicians, because as Emma just said, she would have preferred if a physician said, hey, there's a possibility that you might experience some of these that may be hepatitis B related or may not, but you should just be, hey, aware that this could happen and it could happen anytime from next week to in 10 years. So I'm really glad you brought that point up. And so the other point I wanted to say is the medication she is talking about, tenofovir, is the current, as of I think right now, September 2025, the top of the line recommended medication to fight the hepatitis B virus. It keeps that virus level that low down. And for most people prevents further liver damage from the virus. And that is often accessible through health insurance, including Medicare, Medicaid, and private insurance. Unfortunately, it's hard to say how affordable it will be. That differs significantly on different health plans. Emma, did you have difficulty or was it stressful in terms of starting that medication or getting access to that medication?
Yeah, I'm really glad you asked that question. So, the medication I'm on now, it's been available as a generic since 2017. But
Mm,
when I started taking it, it was not like it was brand name only. And
mm,
there weren't really any good options available as a generic when I started on treatment. And so, like, my doctor said to me like this is the medication we recommend, however it's going to cost you $800 a month.
wow.
And I was like, oh my god, like
Yeah.
that's literally like more money than I make. I'm like, that's like more money than my rent. Like, how am I going to pay for this?
Yeah. Yeah.
Right.
Hmm.
So that just made the situation, I think, more stressful.
Yeah.
Luckily for me at the time, I was on my mom's health insurance still,
Hmm.
and she contacted them to see like if they would be able to cover it. Um,
Hmm.
I think like she still had to go through this like pre-authorization red
Hmm.
tape sort of thing to get access to brand name drugs. Um,
Hmm.
but they did approve it, and they ended up paying 80%, which is pretty
Mm.
good. And then
Yeah.
also the hospital, they let me know about this other like patient assistance program that
Yeah.
paid for like the majority of the rest of the cost. And
Great.
so I'm very grateful that I was able to get access. But again, I want to acknowledge that there are a lot of people, especially in like other countries, where you just like can't get the medication at all.
Yeah. That I mean, Emma's story is almost exactly what often happens here. Fortunately, there are some patient assistance payments programs. If you are experiencing this and need help to navigate this, please feel free to reach out to us. Again, especially if you're in the Bay Area, our number will be in the description as well as our at the end of the session. And so if you give us a call, someone will get back to you, and we have helped folks navigate to try to find some of these programs or see how their insurance, at least give a plan on how they can figure out what insurance might provide. And then there are some sliding scale fee programs around the Bay Area. And we will do our best to assist you. And so I'm curious after are you off your parents' insurance now?
Oh yeah, I'm way too old to be on my parents' insurance. The other thing that I would recommend for people looking to get on medication for hepatitis B, so there's this website called GoodRx, and
Mm,
you can search for medications on there and download coupons that can be used at various pharmacies,
Yeah.
including like mail delivery. And I have seen the first line treatments, such as like the one that I'm on, available for, like $50 for a 3 month supply. So I think that's a pretty reasonable price that like most people could probably
Hmm.
afford or justify. Um,
Hmm.
the other thing that I'm aware of, I believe that most health insurances are actually required to cover HIV PrEP at $0 cost sharing.
Hmm.
And a lot of the medications that are used for HIV are also effective against hepatitis B. So
Right.
I guess the classic example is like Truvada. And
Yeah.
so, I mean, if you can't afford hepatitis B medication, like I would see if you can just like get on Truvada through the like $0 PrEP program, to be
Yeah.
honest with you.
Yeah, Emma, it's great talking to you because it's as someone who has hepatitis B, but you also know a lot of these solutions, or you're very knowledgeable on a lot of treatment things, and I that's one of the things that I was so impressed about when we first chatted. And so thank you for sharing those resources. She's absolutely right. There's a company called GoodRx that really helps find discounts on certain drugs, so that's definitely something folks should look at. I think in terms of the HIV medication, here on this, as a nonprofit, we cannot promote that you take a drug that you're not officially told to take from a physician, but there are things that you can work out for among your physician, and resources that do make sense. And physicians do often prescribe drugs that are quote for symptoms that are off label. And so that's something important to talk to your physician about. Great. I think so in now this more recent journey, it seems like you've been interested in becoming an advocate. Did you end up finding other people that have hepatitis B? How did you decide to start trying to get more involved?
Yeah, so I still don't know anyone who also has hepatitis B. I mean, I probably do, but not that they've discussed with me.
Hmm. Hmm.
Um, I'm hoping that I can meet more people through working like with hepatitis B free and volunteering at events, stuff like that.
Hmm.
Um, I guess I decided to get involved more. Recently, I started participating in a clinical trial
Mm.
to evaluate a new treatment for hepatitis B. And so this new treatment is it's a bit different from existing treatments that are out on the market now, because it's designed to be a finite course of medication that results in what they call it a functional cure, which is
Hmm.
where the
Hmm.
virus is suppressed to like such low levels that we no longer need to take medication every day
Hmm.
for it. And generally, if people can achieve that, the health outcomes are even better than
Right.
what you get being on like long-term
Yeah.
antiviral medication like I am now.
Hmm.
And so I thought to myself, like, you know what, if this treatment works for me, I really want to give back. And then
Hmm.
a week later, I was like, you know what? Even if this treatment doesn't work for me, I still want to give back because, like, I can. You know what I mean?
Yeah. Yeah.
And so then I started looking around to see if there were any organizations that could help me get involved. And I found Hep B Free and the Hepatitis B Foundation, and
Hmm.
like reached out to some people, checked out some of the content on YouTube, and I feel like I've learned so much more about hepatitis B than I like even knew before,
Hmm.
through, like advocating for Hep B and trying to like reduce the stigma. I mean, my opinion now is like if I can convince people to like get tested and get connected to care, at the end of the day, I don't care if you like got hepatitis B through mother to child transmission like I did, or if you got it from injecting drugs. Like,
Hmm.
I think what matters most is that people get connected to care and that people get
Hmm.
on treatment, and just like it sucks, but I want people to know that it's like not the end of the world.
Yeah, absolutely. That leads me to my next set of questions, which is, do you feel that hepatitis B affects your daily life now? And what would you tell to someone, given the space you are now, who just found out they have Hep B or is worried about having it but is afraid to get tested?
Yeah, I mean, I think it sometimes does affect my life. One of the things that has been difficult for me is I'm kind of like careful about who I get close to in terms of, like being in a relationship,
Mhm.
because it's just hard to know like when to disclose that information.
Yeah.
Um, and I still do worry about rejection. Like one
Hmm.
of the things that's good about hepatitis B is that it is preventable by a
Right.
vaccine. And so like when you tell people that like look, I have hepatitis B, but like you can go get this vaccine to protect yourself if you're like worried that you might get it from me. Um,
Hmm. Hmm.
and I think I've come to realize that people who aren't like receptive to that information, and are still scared and still like judge you and treat you differently, like those types of people are probably like not worth having in your life
Yeah.
anyways.
You're dodging a bullet. If that is a problem for them, then you're better off definitely not dating that person.
Yeah, I agree. I'm just like, you know what, I'm giving you solutions and you're
Yeah.
still not willing to listen.
Yeah. Yeah.
At that
Uh,
point, I can't help you.
yeah. Yeah. And so yeah, what would you tell? Let's say there's another version of Emma who just finds she's 26 or 30 and just finds out that she got has chronic Hep B. What would you tell that person?
Yeah, I think I would tell them that like it's not the end of the world and like you can live a healthy life, but there are other things that you need to be like more careful of, and like be proactive about like getting getting ongoing medical care. I think one
Hmm.
of the things that happens with people, especially if they test positive at more like community based screenings, like you go to a
Hmm.
blood bank, you go to a sexual health clinic and get
Yeah.
um, a free test and it comes back positive. I think, especially in those situations, there isn't really follow up where people are told like what to do next. And so,
Yeah.
a lot of the time, patients they need to like ask to see a specialist,
Yeah.
and they might not know that they need to see a specialist or like what type of specialist to see.
Hmm.
And so I think that's what I would tell someone who's just gotten diagnosed, that they need to like get a referral to a specialist.
Yeah. Yeah, absolutely. I think that I totally agree. I think, and that's one of the things that is decisively missing, like having someone who is like sympathetic and compassionate on like let me help you understand, where this is going. We hear from a lot of doctors, and we work with a lot of doctors, some who are very compassionate, but some who, in their lives, their training is here's the solution, here's what the disease is going to do. Like, this is how you move forward. And then it's like, oh, come in every 6 months, make sure your liver health is okay, don't drink, and you should be fine. But there's a difference between that and saying, okay, this might be very scary, but you should know that most people can live full, healthy lives if they manage it correctly. And, here are the stigmas and the myths that you might encounter, but here's how you can educate people. Here's the Hep B free website where there are videos that you can show your friends and family and education material. So it's much more consumable for the average person, as opposed to saying like, go visit the CDC website or go visit this health systems website where it's just a block of text. And so that's one of the reasons why our organization exists. And so I think that that is very true and something we really need to keep working on. Um,
Yeah, I think I would also let this, I guess, like younger version of myself know about like support groups where they can
mhm,
like talk to other people going through the same thing. One that I discovered like not long ago is I think it's called hepbcommunity.org. It was actually
mhm,
started by Thomas too, who you interviewed on this show,
mhm,
ironically. But I think that that's a really great resource where you can also connect with people from all around the world
mhm.
and learn more about, I guess, the public health challenges that exist in other countries,
Yeah.
in addition to just in the US. And that's been really eye opening for me as well to participate in that community.
Yeah, absolutely. Dr. Tu's site is fantastic. There's also real life stories that people have shared, which is really brave of them. I remember I was following a chain of, I believe, a uh, man or woman in Africa somewhere who was pondering whether to tell their current partner about their hepatitis B and was really, really worried, kind of like you, Emma, is saying in relationships. And the person in the post said, okay, I think I'm going to tell my partner next week, and then came back, and everyone was super encouraging and saying, hey, if they don't accept you for you and the fact that this is preventable, then they're not the right person for you. And the person came back and said, yes, it didn't go so well, but through your guys' support, I realized that someone should not be upset by this because it's preventable. So thank you for being there. So Dr. Two's community is really great like that. I will say we at the what we're calling the Hep B Free Network are also in the works to try to make region specific discussion boards. And so we hope to have that functionality up in the next year or so. And so that we're really excited for that. I think the last question I have for you is that is there anything into the future that you're excited to see in terms of prevention? I know you talked a little bit about this functional cure, but anything else that you are excited for or want to leave our listeners with?
Yeah, I think we really should normalize getting tested for hepatitis B. I think actually the CDC has new guidelines where they support one-time screening for hepatitis B for everyone,
Yeah.
regardless of risk factors.
Yep.
Currently, they already do that for HIV, and
Hmm.
I guess the big thing is that the status quo of risk-based screening that they do for hepatitis B, it hasn't really worked.
Hmm.
The statistics that I've seen are that even in the US, only about 30% of people who are estimated to be living with hepatitis B are aware of it.
Hmm.
And even fewer of them are getting ongoing care and management for it.
Yep.
And so I think if we can normalize getting tested, um, we'll be able to catch a lot more people and prevent them from falling through the cracks. I think, unfortunately, the risk based testing criteria are kind of stigmatizing because you don't really want to admit to people that, like, you've been injecting drugs and
Yeah.
that's why you're getting tested.
Yeah.
Um, so I think that's something that I would like to see improved. Um, Also, I know recently there's been some pushback on the hepatitis B birth dose vaccine. Um,
Yeah.
and in Canada, they actually still don't give the birth dose vaccine to everyone nationwide. Like each province has their own criteria. And
Hmm.
unfortunately, like where I'm from, they still don't give it at birth. They have like a vaccine program for like elementary school kids.
Hmm.
And I understand why they implemented it that way to begin with, because they thought, if we can get these like preteens vaccinated before, I guess, like more of the behavioral based
Hmm.
risks start, then that will help.
Yeah.
And like it has helped, but the problem is like mother to child transmission of hepatitis B. The younger you are when you get hepatitis B, the more likely it is to become chronic.
Yeah. That
So like
lifelong.
90 to 95% of like older children and adults who get hepatitis B will like recover. Um,
Hmm.
but then if you have infant exposure at birth, it's kind of flipped, where 90% of people will end up with an infection that lasts the rest of their lives. And
Right.
so that's really why I think the birth dose is so important.
Hmm.
Um, and I think like every like soon to be parent should at least know like the reasoning why they're vaccinating for hepatitis B at birth.
Right.
And it's because infants, if they are exposed, they're extremely likely to get this infection for the rest of their lives.
Yeah, you said it perfectly. I think, and that's why everything that Emma just said is why we, at Hep B Free, are trying to work with health systems as well as like the national guidelines to try to make Hep B screening, one-time Hep B screening, a universal thing for everyone. Fortunately, if you live in the Bay Area, Stanford University Primary Care is one of the few like big plans that have done it. UCSF is also has some level of universal Hep B screening as well, and so we're slowly making progress. There are several health institutions that serve mostly immigrant Chinese folks that do universal Hep B screening as well, but we need to make it, we believe, along with CDC guidance, that it should be universal at least one time so that folks can do that. And then there's no stigma because everybody's getting it done. And one of the things that Emma also said in terms of stigma is not only if you might have multiple sexual partners or men who have sex with men or are a drug user, but folks who are not in that category but fall under risk from being from Asia, like will see those other risks and go, oh, I don't want to be associated with those other risks. And so it builds this additional stigma because they fall into the at-risk group. And so we've talked about that a lot with physicians as well on why that the risk-based screening approach may be stigmatizing, even if it's factually by risk correct. Um, yeah, so I think with that, we'll end it. Was there any final comments you want before I do our little outro?
Um, No, I've really appreciated like talking to you, sharing my story, sharing hopefully correct information about
Yeah.
hepatitis B.
Totally. All right. Well, thank you so much, Emma. This has been episode 17 of Living with Hep B. Again, I'm Richard So, the executive director of Hep B Free. And in terms of reaching us, you can reach us on all of our social media at Facebook at SF Hep B Free. On our Instagram, we changed it from SF Hep B Free to Hep B Free. So that's something different. And then our website is at sfhepbfree.org. if you have any questions, especially in the Bay Area, but if you have questions, we have a navigation helpline that is 415-336-2629. If someone doesn't pick up, you can leave a message and we will get back to you. That's in Cantonese, Mandarin, or English. And we will have all this information in the description below. If you want to visit the online community that Emma spoke about, that is at hepbcommunity.org, and it's a discussion board. You do have to log in and create an account. But otherwise, thank you so much for your time today. Oh, the last thing that I wanted to highlight is, yes, right now the birth dose vaccine is under attack from the current federal administration. Please, if you get the chance, remind folks of why it is important to get the Hep B infant birth dose. The current secretary had said some misinformation saying, oh, look, infants aren't having sex. Why do they need this? With totally this uh, uh, forgetting the whole idea that mother to child transmission happens and is a major source of that transmission. And so that is why it is so important. So thank you for your time, and thank you, Emma, for sharing your story with us. And I want to show everybody the shirt that Emma is wearing because she got it for our run. And if you come see us out in the community, come stop by and I'll see if I have any extra for you. And we always have a couple events, including that annual run each year, and we'll send out more information. So please subscribe to us or shoot us an email, and you'll know about all of our events coming into the future. All right, with that, we'll say goodbye and have a good one, everyone. Thank you, Emma.